Hi, I'm Dr. Waters, and this morning we're going to talk about fatigue. Fatigue is probably the main complaint that people go into medical doctors for in this country. Unfortunately, most doctors don't take it very seriously. Yes, they'll do a thyroid test, they'll ask you if you're depressed very early in the conversation, but it's my experience that most people are fatigued because they aren't making enough energy in the little organelles in our cells called mitochondria. Now, 90% of the energy made in the human body is in fact made in the mitochondria, and it requires oxygen to be present along with a variety of nutrients, most of the B vitamins, most of the trace elements and minerals that we hear about and go to the health food store to obtain, like magnesium and zinc and copper, as well as important amino acids such as L-carnitine and vitamin-like substances such as coenzyme Q10. So when patients come into this office and say, "Doctor, I'm fatigued," I say to them, "Well, you're telling me you're not making enough ATP energy. You're not converting fuel into usable energy." And by the way, this also results in the buildup of acid products because we tend to just then ferment sugar to make our energy, and this buildup of acid products makes us hurt. And so most patients that have fatigue also say that they ache, their joints hurt, their tissue hurts, and then they get written off as having chronic fatigue syndrome or fibromyalgia. Of course, they came into the doctor saying that they were chronically tired and that their fibrous tissue and that their muscles, myos, hurt. And so the doctor merely converts the symptoms into a Latin or Greek phrase, and that begs the question, what really causes this? And that's, of course, what patients want to know. So in our office, of course, the first thing we do is change the diet to a highly nutritious, low carbohydrate diet and get people on an mild exercise program with the stepping up of such until they're able to work up a sweat and activate their mitochondria to burn energy. And then we correct the findings of the laboratory. And what do we see with patients with chronic fatigue? We see very often that their adrenal glands, two little glands on top of our kidneys that make about 20 steroid hormones, that these glands are very weak. They're not making enough hydrocortisone to regulate their blood sugar. They're not making enough DHEA to help them repair tissue, to help their immunity. And very often their thyroid gland is also weak. And sometimes the TSH level that's mainly used to measure thyroid function by doctors is only in the lower part of the range, but in fact they benefit from thyroid hormone because both hydrocortisone and thyroid hormone are needed in the mitochondrion to manufacture energy. Then of course we correct the trace elements, magnesium, zinc, copper, chromium, and all of these function in the chemical pathways with which we make energy. Finally, we add coenzyme Q10 and carnitine in proper doses based on the laboratory to activate the mitochondrial activity. I must say that another finding we see almost universally in ill patients is they are low in the omega-3 family of essential fatty acids. And these are known as EPA and DHA and are found in fish and algal products, and we administer these in rather high doses to rebuild all of the cellular structures. People don't know this maybe, but our cells are made of fats. Our brain is 60% fat, of which a quarter of that fat consists solely of one called DHA. So if one doesn't have the correct fatty acids in their body, they cannot make proper brain cells. And remember that our brain regulates every cell of our body through the autonomic vegetative nervous system. So basically, we change three things in the case of fatigue patients and fibromyalgia patients. And we like to look at our paradigm briefly as the three M's: meals, microbiome, and mitochondrion. So we help people change their diet and lifestyle. We help their gut. Very often patients have intestinal problems, malabsorption, gas, bloating, belching are the symptoms, and they are not getting proper nutrients into their bloodstream even if they're taking them. And finally, what we just discussed, repairing the energetic potential of our mitochondria. And when all of those things are corrected in a 1 to 3 month period, we see that the great majority of patients recover their energy, their fatigue goes away, their pain goes away, and they go back to a much happier life.